And more women are suffering from sexual problems, how a new treatment could help you and your relationship.
Serving all of San Diego, this is your Fox 5 News.
Well, more women than you may think are suffering from sexual problems, but now there's a brand new treatment available. We've got Dr. Irwin Goldstein. He is director of San Diego Sexual Medicine at Alvarado Hospital, and his wife, Sue Goldstein, are here with more on how it can help women and their relationships with their partner. I'm glad your other half is here because then we can talk to both of you about it, and you're helping with the clinical studies, which is awesome. So let's get down to what this drug is. This is a historical breakthrough.
Yeah, so the FDA, for the first time in history, approved a drug for sexual problems. I mean, for our field of sexual medicine, this is like a nuclear bomb. It's an explosion. It's fabulous. So there are 50 million women with menopause. Maybe 5 or 10% actually take hormones. The vast majority don't. So there's going to be problems with the end organs being dry and problems with sexual activity. So this is a drug you take by mouth every day, and it makes the genital tissue more lubricated and less painful. So it's very exciting.
Is it similar to anything else that's on the market?
Not really. It's a new class called a VARM, vaginal estrogen receptor modulator. VERM is the title. It's you take the pill and it acts directly on the vagina to make it more healthy in women in menopause.
There's a statistic here, more than 40% of women suffer from sexual dysfunction, and now this treatment is available. That's huge, 40%, and we're talking about women with menopause. Who exactly is this for? Is there a specific age group, a specific woman out there, a viewer, anyone who's watching who this is specific for?
So women tend to be after age 50, and they live till age 80, so they have many years in menopause. So if they're interested in, there's Viagra, so men have something. This is the first time we have something for women in the age group where men typically take Viagra. So this is very exciting news.
All right, and then I guess for both of you, and Sue, you can help me out with this one. What's the best way that women can get the help that they need? And do you think a lot of women may be embarrassed to come to their doctor and explain what's going on?
I think women are not only embarrassed, but they don't realize that there is help available for them. The internet is a wonderful resource to find somebody who is specialized in sexual medicine or has knowledge of this field. They can also look for research that's being performed, which is something that we do at our facility. They can talk to their gynecologist. But many women are afraid to start the conversation thinking that they'll embarrass their physician. Don't be afraid. Make yourself educated and empowered. If you have a problem, ask. And if your physician can't help you, find somebody else who can.
And speaking of research, what other clinical trials are going on?
Well, we have research in all areas of sexual health. For the younger woman with pain, as well as the older woman who can be helped by this medication. For women who have trouble reaching climax, we have research currently. We're looking forward to starting some new trials for women who have decreased sexual desire. We also do research for men with sexual problems. And if somebody is watching who has an issue and is not sure if we have any research, you're welcome to call and we can talk to you and let you know what we have available. And we also do research in other areas that are related to sexual health, for instance, interstitial cystitis or overactive bladder.
Now it says here that a drug for women with low desire, which you were just mentioning, will be submitted to the FDA for approval later this year. Can you tell us about that?
Yeah, this is 2013 is the year of the woman in our field of sexual medicine. So
he gets so excited.
this quarter, and I was just at the advisory board meeting, they're going to submit a new drug application. It's over 1 million pages, by the way,
wow.
For this drug for women with low interest. This is premenopausal women. Mm-hmm. And they have an AdCom advisory committee meeting at the FDA already scheduled for July. And if it's all successful, we should have this in the fall, which would be unbelievable.
And then there's a statement people can sign called the WISH statement.
Oh, yes.
What is the WISH statement?
Sue, do your thing.
Sue.
Well, WISH was started by the International Society for the Study of Women's Sexual Health. And this essentially says that women have a right to control their own bodies. If they have sexual health issues and they want treatment, they have a right to choose it. We're looking for 1 million signatures. You can go online to yourvoiceyourwish.com and simply sign it electronically so that when the various drugs companies go to the FDA looking for approval, they will understand that this is not something made up by drug companies, that these are women who need help, these are physicians who provide the help, who have all signed the statements stating that this is a real problem and they want real help.
All right. Well, thank you two both for being here to
Thank you,
wrap this
Heather.
up.
The FDA has no drugs for women. Just now, we have one drug for women in menopause, and as we gain more opportunity, we are going to expand treatment options, so women will have choice.
And for people who are watching, when is that available? The drug that we were just talking about, the one that the FDA just approved?
Probably in a few months. It has to go to the drugstores and all that stuff and get distributed, but it'll
Okay.
be out soon.
All right.
Osthema is the name.
All right, we'll be getting in touch and keeping in touch with Dr. Goldstein if you would like to. He is at the San Diego Sexual Medicine Clinic located at Alvarado Hospital. Contact him, and his information is up on our website too, fox5sandiego.com, and click on the Scene on tab. Raul, I'm going to send it back to you for now.
All right, guys, thank you very much for that.